Hello friends, welcome to Kavita Medicos Education, and this is part second of bronchitis. So in part second of bronchitis, I am going to start with the clinical manifestation of bronchitis. So let's start with the sign and symptoms of acute bronchitis first. First we have cough that will be in a dry and later mucus. Okay, so in starting phase of acute bronchitis, the patient will have a cough condition, and this cough will be in a mild form and this cough will be in a dry form. Okay. Next we have clear and white mucus. So in acute bronchitis condition, in a starting phase, the patient will have a mucus production, but that mucus will be in a low quantity and it will be in a clear and in white form. If this mucus is converted into greenish or in yellowish form, it means any bacterial infection is also present there. Next we have dyspnea, mild and temporary. So in acute bronchitis, the patient will have shortness of breath condition, that is called as dyspnea, but this dyspnea will be in the temporary or in the mild form. Next we have chest discomfort, that will be in a mild form. So patient will have chest discomfort because he is suffocating for the oxygen in the body. Okay, patient is trying to get the oxygen from the environment, so he will feel heaviness and discomfort in the chest, but this discomfort or heaviness or tightness in the chest will be in the mild form. Next we have fatigue. So there will be fatigue or tiredness condition seen in the acute bronchitis because our immune cells are reacting against the antigen particles. Okay, the irritant or flu or any type of pollutant which you are inhaling from the environment, that is the antigen, and our body, our immune cells are reacting against those antigen particles. So there is antigen antibody fight. Due to this reaction of our immune cells, there will be fatigue and tiredness condition will generate into the patient. Next we have mild fever, and due to this reactive process of our immune cell, there will be mild fever condition is seen in the acute bronchitis, and this fever will remain in 101 degree Fahrenheit or 38 degrees Celsius condition, but this fever will be in a mild condition because our body is fighting back against the infection. Next we have sore throat. There will be soreness in the throat of the patient. So due to the upper respiratory tract infection like cold or flu, so this cold or flu get spread into the lower respiratory tract also by the dripping of nose in the backward direction. Okay, so there will be post nasal congestion will happen in the lower respiratory tract. So patient will have hoarseness in the voice or there will be soreness of throat. Next we have runny or stuffy nose. As acute bronchitis is caused by the cold or any flu infection, so patient will have a stuff or runny nose condition. Next we come to the chronic bronchitis sign and symptoms. First we have persistent productive cough. So here the cough will be present in the patient, but this cough will be in the productive form. It will be in the large amount and it will be persistent. Continuous coughing will be there, and this cough will remain for at least 3 months for 2 consecutive years. Okay, so in a year the patient will have a cough for more than 3 years, and this cough will persist for 2 consecutive years. Next we have excessive mucus production. So a large amount of mucus will be formed, and this mucus will be very thick, which we called as a phlegm, okay, or bulgum. So this mucus will be in a heavy amount, okay, or this mucus will be in a thick condition. Next we have dyspnea. There will be shortness of breath condition is seen in the patient. Why there is shortness of breath? Because our bronchi or bronchus are inflamed or swollen condition. So the lumen size have become narrow. The bronchi or bronchus pathway of air have become narrow. Therefore the patient will try for the oxygen, will suffocate for the oxygen. Okay, so patient will have dyspnea or shortness of breath condition, and this dyspnea or shortness of breath condition will become pathetic or worsen over time period. Next we have wheezing. Wheezing means a high pitched whistling sound will be come out from the lungs of patient. Okay, so this crackling, ronky or whistling sound will come out from the lungs of patient. Why there will be whistling sound? Because our bronchi or bronchus have become narrow because due to the inflammation or swollen condition. So a high pitched whistling sound will come out from the lungs of patient while he will exhale out the CO2 from the body. Next we have chest discomfort and tiredness. Okay, so patient will have chest discomfort, heaviness and tiredness in the chest. Why? Because for breathing in and out, he is using all his accessory muscles like the neck muscles, chest muscles or abdomen muscles. So for breathing in and out, he is using all his body muscles. Therefore, he will feel chest discomfort, tiredness and heaviness in the chest. Next we have fatigue, tiredness, exhaustion. Again, due to the use of all the accessory muscles and all the energy of the body, the patient is trying hard for the oxygen inhaling process and exhaling process out. So he will feel very fatigued, he will feel very weak and tired and exhaust condition. Again, the patient weight is severely lost in the chronic bronchitis condition. Therefore, he will feel more tiredness and fatigue condition in the later stage. Next we have cyanosis. This cyanosis means bluish discoloration of the body. So a bluish discoloration is seen in the lips, in the finger, in the toes and in the skin of the patient. So this cyanosis condition comes in the advanced stage of chronic bronchitis. If this chronic bronchitis may convert into the COPD condition or in the more respiratory in a very dangerous respiratory condition, then the patient will suffer from the cyanosis condition. Next we have clubbing of fingers, means there will be thickness in the finger toes. Okay, so patient will have a thickened finger toes and he will have the sharp nail bed which will be in the curved form. Okay, so this clubbing of finger condition comes in the later or in the at the late stage of chronic bronchitis. Okay, when there is a pathetic or very dangerous condition of chronic bronchitis. Okay, when there is a severe hypoxemia condition or low oxygen level is seen in the blood of patient, then there will be clubbing of finger condition is seen. Next we have frequent respiratory infection. So why there is frequent respiratory infection? Because due to the accumulation of lot of mucus and bulgum, the lots of microorganisms or pathogen will infiltrate into that area. Okay, next we have swelling or edema condition, because the blood which is going from the right side of the heart into the lungs will not able to filtrate in a proper way and this blood will backflow into the right heart. Okay, and again this blood will backflow into the body of the patient. So in advanced stage of chronic bronchitis or COPD condition, the core pulmonary condition is seen in the patient. So due to the backflow blood, our body will suffer from the edema or swelling condition. This swelling can be seen in the hands, in the leg, in the neck of the patient and in the feet of the patient also. So this was the clinical manifestation of bronchitis. Next we have diagnostic evaluation of bronchitis. So first diagnostic test we have patient history and physical examination. So a history collection of past and present is done here. So all the medical history of the patient is collected here. So we can ask several questions of patient like, is anyone in his family suffering from any respiratory condition like COPD, pneumonia, tuberculosis or lung cancer? And we can also ask the patient about his occupation. Okay, is patient is occupationally exposed to any pollutant or not, or if the patient is allergic to any medication. Okay, so a complete past and present history has been collected here. Next we have physical examination. So a complete head to toe examination of the patient is done here. Mainly we will do the auscultation procedure here, where through the stethoscope we will check the lung sound. Is any ronky, crackling or any whizzing sound is coming out through the lungs or not. And we will also do the inspection of chest here. That is how patient is inhaling and exhaling the air out. And you can also check the patient through the observation of the sign and symptoms of the patient here. Okay, and main thing you will do in physical examination, that is vital sign. Checking the body vital sign is very important. Next we have chest x-ray. So chest x-ray is the visualization of lungs and heart here. So this chest x-ray will be visualized best when the patient is having a chronic bronchitis. Okay, if anything is not so visualized, not so good visualized in the chest x-ray, then the physician will go for the CT scan. CT scan means computerized tomography scan. It will give the clear cut images of all the bronchi and bronchioles here. Next we have blood test. So in blood test we will check for the microorganism. Is there any virus, bacteria is present there or not? And again in blood test we will mainly do the CBC blood count, that is complete blood counts. And if the amount of WBC is increased in the blood count, it means the patient is suffering from any bacterial infection here, okay. And in this blood test we will also check the eosinophil count here also, okay. We will do the allergic test of the patient here also, mainly which allergen? IgE, okay. So we will check the WBC rate and eosinophils rate here, okay. So blood test is very important for checking the pathogen or microorganism in the blood. Next we have sputum culture. So a phlegm or sputum culture is important for any bacterial or viral infection in the sputum, okay. If patient is suffering from any cold or flu infection, then sputum culture is very important. Next we have nasal discharge. A nasal swab is taken mainly for checking the influenza virus or coronavirus here. So nasal discharge, and we can also check the biopsy here, okay, nasal biopsy. So a biopsy test can be also done here, in which a tissue sample is taken from the bronchi or bronchioles, okay, and the tissue sample is sent in the lab for diagnostic procedure. Next we have pulse oximeter. So it is an invasive test. It is a non-invasive test in which a small device is inserted into the finger of the patient, and through the pulse oximeter we can check the saturation rate of oxygen in the blood, and other vital signs are also checked through the pulse oximeter. Next we have pulmonary function test. So in PFT function test or lung function test, we can go for spirometry test as well as for lung function test here, lung volume test here, LFT test here, okay. So mainly in PFT test we will check the inhalation as well as the exhalation rate of the patient, and how much residual volume of air is being left in the lungs. So we will check the complete vital capacity of the lungs in the PFT test. Next we have ABG level. So it is called as arterial blood gas level, in which pH level means how much pH of the blood is there. So normal range of pH is 7.35 to 7.45. If the pH level is low, it means the patient is suffering from the hypoxemia condition, okay. There is more amount of carbon dioxide level in the blood of the patient. That's why the patient pH level is low than 7.35 to 7.45. Next we will check for the partial pressure of oxygen here. So what is the normal range? That is 85 to 100 mmHg. So we will check the partial pressure of oxygen here and partial pressure of CO2 here. So normal range of PCO2 is 35 to 45 mmHg. It is the normal range of PCO2 here. So if the patient is having more PCO2 level, it means the patient is having more carbon in his blood, okay. So we will go for ABG analysis. It is very important, a crucial test in the respiratory disease condition. Next we have bronchoscopy. So in bronchoscopy test, a flexible catheter tube is inserted into the trachea in the windpipe of the patient, and through the bronchoscopy test we can see the video images of the bronchi and the bronchioles, okay. It will give the very clear video and very clear images of the bronchi and bronchioles, okay. Why there is scarring, why there is fibrosis, why there is narrowness in the diameter of the bronchi there, okay. And through the bronchoscopy we can also suction out the extra mucus, extra phlegm, which is obstructing the pathway of the bronchi. And through the bronchoscopy we can also collect the biopsy sample from the bronchi. So these was a diagnostic test for the bronchitis. Next we have medical management of bronchitis. So first medicine we have, that is bronchodilator. As the name is indicating, the bronchodilator medicine will increase the diameter, okay. It will widen up the diameter of our bronchi and bronchioles. So there are three classes of bronchodilator. First we have beta-2 adrenergic agonist. This beta-2 adrenergic agonist will block the adrenaline receptor, because this adrenaline receptor is doing the contraction of the bronchi and bronchioles. So by giving beta 2 adrenergic agonist, the bronchi and bronchioles diameter will get widen up and the smooth muscles will get relaxed. Next we have anticholinergic drugs. Okay, this anticholinergic drugs will inhibit or stop the action of acetylcholine, because acetylcholine is doing the contraction in the smooth muscles of bronchi and bronchioles, and again it is increasing the mucus production there. So by giving the anticholinergic drugs, we are stopping the action of acetylcholine, which is a neurotransmitter, by which the diameter of the bronchi and bronchioles will get widen up and the smooth muscles will get relaxed, and there is less production of a mucus or phlegm. Next we have methylxanthine. It is also doing the relaxation of smooth muscles. Okay, so there are many forms of bronchodilators, like short acting bronchodilators and long acting bronchodilators. So short acting bronchodilators will work in very quick way. Okay, their mechanism of action is very quick, but they will give relief to the patient for a short duration of time, like 4 to 6 hours. And some bronchodilators are also long acting. Okay, they will slowly do their mechanism. Okay, they will slowly do their action, but they give long lasting effect to the patient, like for 12 hours. Next we have corticosteroids. So corticosteroids medicines do the anti-inflammatory property. Okay, they will decrease the inflammation in the bronchi and in the bronchioles. Okay, the swelling and inflammation is decreased by the corticosteroids drugs. Again, it will also decrease the immune response. Okay, the hyperimmunity is dangerous for our respiratory tract, because the hyperimmunity will do the inflammation and swelling in the bronchi and bronchioles, and again it will make the fibrosis here. So for decreasing the immune response or for decreasing the allergic reaction, we will give the corticosteroids for anti-inflammatory property. Next we have mucolytics, as this drug is thinning the mucus. Okay, so mucolytic drugs will break down the phlegm or bulgum into a thin mucus, so it will be easy for the patient to cough it out. We have example like acetylcysteine and ambroxol. Okay, so mucolytic drugs will break down the phlegm or mucus into a thin secretion. Next we have antibiotics. If the patient is having a bacterial infection, okay, normally in acute bronchitis there is viral infection as well as bacterial infection. So viral infection will heal by itself in 1 to 3 weeks, but bacterial infection, if some person is having bacterial infection or there is chronic bronchitis and the person is having bacterial infection, then we will provide the antibiotics for inhibiting the effect of bacteria or for decreasing or diminishing the growth of bacterial infection. We have example like azithromycin, amoxicillin and doxycycline. Okay, next we have anti-inflammatory, and again anti-inflammatory will decrease the inflammation, swelling and redness in the bronchi and in the bronchioles. Next we have antitussive drugs. So these antitussive drugs will suppress the cough reflection in the patient. If the patient is getting dry cough or he is irritated by the dry cough in the night or in the daily activity of life, then we will give the cough suppressant medicine. There are many form of antitussive drug which will act on the central nervous system, or there are many form of antitussive drug which will only do its action in the peripheral or in the respiratory system only. So if patient is getting a dry cough, then we will give antitussive drug to the patient like dextromethorphan and codeine and hydrocodone. Next we have vaccination. So vaccination is very important for preventing the bacterial or microorganism infection. Okay, so there are flu vaccine which is given for the influenza virus, and there are pneumonia vaccine which is given for streptococcus bacteria, okay, which will cause the bacterial infection or pneumonia in the patient. So vaccination is very important for preventing from the dangerous condition or bacterial infection condition. Next we have analgesic. If patient is having a cough if patient is having a pain due to cough, then we will provide the analgesics. There are many form of analgesics like non-opioid analgesics, example PCM, paracetamol or aminophene. Next we have opioid analgesics like morphine. So analgesics are given only in the prescription of a doctor. So these were the medical management of bronchitis. Next we have nursing management of bronchitis. So as a nurse, how you can give care to the patient? First we have avoid smoking or irritated particles. So you have to educate the patient for cessation of smoking. Okay, so tobacco smoking, second-hand smoking or any kind of smoking is harmful for the lungs. So you can educate the patient for stopping or cessation of the smoking. Next we have to remain away from the polluted areas, to remain from the allergic areas. Okay, dust, fume, chemical dust is harmful for the respiratory system. So you can educate the patient to remain away or keep a distance from the irritated particles. Next we have check vital signs and breathing patterns. So monitoring the vital sign of patient is very important. And next, very important, that is breathing patterns. So we can observe how the patient is taking his breath. Okay, what is the rate of his respiration, how much is the depth of the respiration. So you have to maintain or observe the breathing pattern of the patient. Is patient is feeling any exertion while he is breathing in and out. Okay, and you can also check for any cyanosis condition in the patient. Okay, next we have drinking plenty of fluid. So hydrating the body is very important. Okay, so lot of fluid and lot of liquid diet is important in the for the patient respiratory system. Okay, because this hydrated diet and plenty of fluid will help in making the mucus thin. Okay, so this plenty of fluid will help in breaking down of the phlegm. Next we have deep breathing exercise. So to educate the patient to do the deep breathing exercise or meditation program. Okay, and you can also teach the patient how to do the pursed lip breathing for exhalation of CO2 out. So we can teach the patient a various breathing exercise. Next we have Fowler position. So whenever patient is feeling discomfort in the ear, or whenever patient is feeling dyspnea condition, shortness of breath, then you can provide a comfortable position to the patient. Okay, according to his need, like semi-Fowler position, high Fowler position or sitting position. Next we have give steam inhalation. So inhalation or steaming is very important for thinning out the mucus or phlegm. So steam inhalation is important. Next, in the home, if the patient is in the home, then he can use the humidifier. Okay, if there is dry air, then we can use the humidifier for making the air moist. So it will be easy for the patient in breathing. Okay, next we have administer supplemental oxygen. If patient is feeling any oxygen decrease, or patient is feeling suffocation for the oxygen, or he is feeling shortness of breath, then we can provide the supplemental oxygen to the patient through the nasal cannula or oxygen face mask. Next we have chest physiotherapy. So a chest physiotherapy is very important for releasing out the thick and viscous phlegm out from the lungs. Okay, so we can do the percussion process in the chest physiotherapy, or we can vibrate the chest. Okay, we can vibrate the chest for releasing the phlegm out from the chest. Next we have monitor for signs of infection. So patient is very prone to the infection from the microorganism. Okay, so he is very near, and the microorganisms can attack the patient easily, because there is a lot of phlegm is being collected in the bronchi and in the bronchioles. So we have to check and observe the sign of infection in the patient. Like we can observe through the sputum of the patient or bulgum of the patient. Is any color change in the phlegm or not, like yellowish or greenish. Next we have nutrition. A good balanced diet is very important for gaining the weight of patient, because due to the coughing process the patient loses a lot of weight. So nutrition balanced diet is important, and psychosocial support we have to give to the patient, emotional support. Okay, next we have wear mask. Whenever patient is going outside, to advise him to wear the mask when he is going into the polluted area. So these were the nursing management of bronchitis. So friends, if you have liked my video, please hit the bell icon, and please like, share, subscribe for more new updates. Thank you.